myself first. My name's Dylan. I'm a student nurse that's going to be doing a NG tube insertion. But first, can I get your full name and date of birth? You check both wrists, make sure. Already here. Full name and date of birth, make sure you have the right person. Ask about any allergies and any type of discomfort that they have currently. I'm going to bring this up to at least the working height. Hand hygiene as well before starting the procedure. Very important. Bring up to working height. So we've asked about any allergies they have, pain. Before starting the procedure and raising their head of the bed, you want to inspect the abdominal area for any type of pulsing, any abnormal signs after inspecting. You would auscultate the 4 quadrants, make sure they have regular bowel sounds as well, and palpate, make sure there's no type of discomfort or discomfort, abnormalities, hardness essentially. So now we're going to go ahead and raise the bed here. And you want them to be ideally in an upright position, but if they can't tolerate an upright position, you want it at least to a 45-degree angle. Get this up here. Alrighty. I'm going to go ahead and drape patient here, blue pad, and prepare an emesis basin. We also have a cup of water here. I'm going to bring a little bit closer. I'm going to prepare the tape that I'm going to be using to secure the NG tube later before I put on gloves. You want one, each of them to be about 4 inches long, and one of those split down the middle. So we'll split this one down the middle. Up there. Open up our tubing. I'm going to go ahead and put on gloves. And before we insert the tube, we're going to want to measure it out. That broke. There's only small gloves over here, so these are a little bit of a pain to put on. There we go. Measuring NG tube, and we only need clean gloves since this is done with clean technique instead of sterile. We want to measure from the tip of the nose to the ear, and then from the base of the peak of the earlobe down to the xiphoid process. Right there. We would then mark it with a piece of tape or a pin, so we know about how far we need to go. We would lubricate the first 2 to 4 inches of the tip of the NG tube here in preparation. You would assess which nostril you'd want to use, whether or not they have pain in one, or if they already have something in the other one, or if their orders indicate they can't have one down one of the nostrils. So you would ask the patient to tilt their head back against the pillow a little bit, and you would start to run the NG tube down the base, the floor of the nose as you go back. If they have any type of coughing or gagging, you would want to inspect with a flashlight and a tongue blade to see if it's going down correctly or if it's balling up in the mouth. If they have extreme distress, if they're cyanotic, or if they're severely coughing or gagging, you would immediately discontinue the procedure. But as you get to the pharynx, you would have your cup of water here, and you would have them touch their chin to their chest, and you would have them sip water, or if they're not allowed to have water at the time being, just make a swallowing motion, and that would get it past the pharynx. And if you meet any resistance, you can rotate it a little bit. And as you go down, this is as far as this goes in, but you would go down to the mark that he had previously made, and you would loosely secure this at the time, since we don't know if it's in or not. And at this point, we would want to aspirate a little bit of the stomach contents. Don't move too much, so you'd aspirate just a tiny bit, a small amount, as it says, of the stomach contents to check for their pH levels. And you'd have a pH strip set up over here on some type of surface, and you would put a little bit of the solution or the stomach secretions from and put it on there. You'd wait about 30 seconds for the color changes. You want it to be about 1 to 4 as the color change indicates. You would back, move this real quick. So now, as long as we've confirmed that it's in the stomach using stomach acid, you'd also visualize the contents that you've aspirated out to make sure type of consistency, color, stuff like that. I picked up the wrong one. But now that we've confirmed that it's in the right area, we're going to secure this a little bit more heavily using this tape. And you don't want to tug or pull on this too much as you're placing the tape, because you don't want to adjust it from its position at all. So now this is secured. One more piece of tape. Across the bridge of the nose to secure it. And so now you have a NG tube working. You would connect it up to the suction, which we've already set. You'd set it to a low intermittent suctioning. And we'd be done. If you wanted to irrigate well, we'll start from right here. So now we're going to irrigate the NG tube after we've had it placed and we know it's in the correct area. We would come back to the setup. You would redrape the patient before doing this if it's not already set up after. And you want to make sure that this is above the stomach level as well, the little air vent for the NG tube. So when irrigating the procedure, for the irrigation procedure, we would go ahead and drop about 30 milliliters of the solution. And I'll go ahead and 30 mils of irrigation solution, usually saline. And you would disconnect them from suction as well, and you would connect the irrigation fluid to the NG tube and making sure it's not into the air port. And you would, depending on what the orders of the facility policy is, you would slowly irrigate the tube with the solution or let it flow by gravity, just depending on what the orders are. So now, and if you don't want to force it in, so if you have trouble pushing the contents in, you would ask the patient to reposition themselves and try again. If that doesn't work, you would inject 10 to 20 milliliters of air into the NG's tube, making sure, again, not the air port. And attempt again. So we would slowly push it in. And now that we've irrigated it, you could either use a emesis basin or connect it back up to suction, but you would remove this and you would observe the return of the NG contents from the tube, either from this, but I'm going to hook it back up. to here, and you can observe it as it goes back into the suctioning canister. Again, making sure that either it's secured to the patient's gown by rubber band, safety pin, tape. That this is again above the patient's stomach. After you're done, you're going to inject a little bit of air into this the air vent. You would pull a little bit of air, insert it into the air, and inject that as well. And then after that, you've successfully irrigated and placed it in G-tube, and we'd be done. We would lower the bed. I also should have lowered this before starting the procedure, but I would pull this back up, and we will bring them back down to their normal height, and lower their head as the patient can tolerate, or to whatever their preferred height is. Remove our gloves. We'd open up the curtains again to provide privacy, and we would also provide hand hygiene again, and remove our PPE gear and clean up our work area. And we're all done.